In the world of dentistry, precision isn't just important, it's everything, especially when you're gearing up for a major exam like the one for the Australian Dental Council. And one of the most critical tools in your arsenal is a pair of dental loupes. But here's the thing. There's so much more than just magnifying glasses. They're about accuracy, posture, and honestly about making sure you have a long, healthy career. So in this explainer, we're going to break down everything you need to know to choose the perfect pair for you. Welcome to the Australian Dental Council 2026 explainer video. I mean, this quote just nails it, doesn't it? Take a second and really picture that. Working on a surface that is smaller than your own thumb. That is the incredible challenge dentists face every single day. We're talking about a field that demands unbelievable accuracy on a scale that is almost impossibly small. And that right there, that is the exact problem that dental loupes were invented to solve.
All right, so to help you make sense of it all, here's our game plan. First, we'll talk about why you even need magnification in the first place. Then, we'll get into the nuts and bolts of a loupe. After that, we'll cover the super important step of getting a personalized fit, help you navigate the market, and finally, we'll wrap up by looking at why this is a true career-long investment.
Okay, let's dive right in. Why do you need magnification? You might think it's just about making small things look bigger, but that's really just scratching the surface. Loupes are a tool designed not just to help you see better, but also to protect your most valuable asset, your own body. So what are the big wins here? Well, it really boils down to three core benefits. First, and most obviously, they let you see fine details with incredible clarity, which means more precise work. Second, they help make up for presbyopia. You know, that thing that happens to all of us as we get older, where it gets harder to see things up close. And third, and this one is a true game changer, they are absolutely crucial for maintaining correct posture. Just look at the difference. On one side, you have that classic hunched-over posture that leads to chronic, debilitating neck and back pain. We've all seen it. But with a properly fitted pair of loupes, you can sit upright in a neutral position, and trust me, this isn't just about comfort at the end of the day. This is about preventing an injury that could literally end your career. So now that we know why we need them, let's get into the nitty-gritty of how they work. To make a smart choice, you've got to understand the basic tech. We're going to look at the two main types of lens systems and the two ways they can be mounted to your frames. First up, the engine inside, the lens system. Think of Galilean loupes as your reliable starter option. They offer lower magnification, they're lighter, and they're way more budget-friendly. They're great for students or for general practice. Prismatic loupes, on the other hand, are the high-performance option. They use a more complex system to give you much higher magnification and a crystal-clear image. The trade-off? They're heavier and they cost more. Next, how are those lenses actually mounted? Your first option is through the lens, or TTL. The optics are built right into the glasses, making them super lightweight with a great field of view. But they're custom-made just for you, so their resale value is pretty much zero. The other option is flip-ups. They're on a hinge, so they're fully adjustable, and you can sell them later on. The downside is they're a bit heavier, and the field of view is a little smaller. This brings us to what might just be the most important part of this whole process: getting a personalized fit. I cannot stress this enough. Loupes are not a one-size-fits-all product. If your measurements aren't dialed in perfectly for you, all those amazing ergonomic benefits we talked about, they basically disappear. So we can break this down into 4 simple steps. First, you've got to nail down your working distance. Second, you need to understand the relationship between your depth of field and field of view. Third, you'll choose your magnification. And finally, you have to factor in that all-important declination angle. And here's a quick tip. For an exam, you'll probably want a lower magnification with a wider field of view. It's more versatile. You can always upgrade to a more powerful set later in your career. Let's start with working distance because it is the foundation for everything. This is the precise distance from your eyes to your hands while you're sitting up perfectly straight, neck neutral, shoulders relaxed. If you get this number wrong, the whole ergonomic setup is compromised from the start. Now, this chart can give you a rough ballpark based on your height. So if you're between 170 and 193 centimeters, you'll probably land somewhere around 42 centimeters. But, and this is really important, this is just an estimate. You have to get this measured properly by a professional sales rep to get it exactly right. Okay, next up is depth of field. The easiest way to think about this is your focus zone. It's the range where everything stays sharp, letting you lean in or out a little bit without losing clarity. A good, deep depth of field is amazing because it means less eye strain and way less fatigue during those really long procedures. And your depth of field is directly tied to your field of view.
which is just the total area you can see at once. And this is where you hit a fundamental trade-off that you just can't escape. The higher the magnification, the smaller your field of view. It's like using a camera lens. When you zoom way in on a single tooth, you lose sight of the rest of the mouth. You're trading a wide view for incredible detail. And finally, we have the declination angle. Let me be clear. This might be the single most important factor for your long-term health. It's the downward tilt of the lenses. If the angle is steep enough, you can look down into the patient's mouth while your neck stays perfectly straight. If the angle is too shallow, you're forced to bend your neck, which completely defeats the entire purpose of having ergonomic loupes.
Okay, so you're armed with all the technical know-how. Let's get practical and talk about navigating the market. We'll cover what you should expect to pay and some of the big brand names you're going to see out there. So what's the damage going to be? Well, the price range is pretty wide. You can find some budget-friendly, non-custom pairs for around $400 or $500, which might be fine for just getting through an exam. But for a professional tool you're going to use every day for years, you're looking at a custom-fitted pair. Those typically start around $1,200 and can easily go north of $2,500.
So where should you start your research? Well, you've got the big established players like Oroscoptic, Surgitel, and Zeiss. Then there are some really interesting brands like Lumident and others like Bryant Dental and Hero Loupes, who are really focused on pushing ergonomic design even further.
And we have to be really clear here. This is not a sponsored video. We're not getting paid to mention any of these brands. This list is just a starting point for your own research. And honestly, the best piece of advice anyone can give you is this. Take advantage of the free trial periods. Almost every company offers one, and it is by far the best way to figure out what actually works for you and your body. And that brings us to our final section, which is all about shifting your perspective. It's about seeing these not as an expense for an exam, but as a true career-long investment with an impact that goes way beyond just yourself. This quote really says it all. Yes, the upfront cost can feel like a lot, but a great pair of loupes pays for itself over and over again. They help you reduce mistakes, which means less rework and better outcomes for your patients. And they prevent the physical wear and tear that can lead to burnout or even force talented dentists into early retirement. So this leaves us with a final, pretty big question to think about. As the demands for precision in dentistry keep rising, and with the high rates of musculoskeletal problems in the profession, should ergonomic tools like loupes even be a choice anymore, or should they become a mandatory standard of care? It's definitely something for the entire healthcare system to consider. We really hope this explainer has given you the clarity you need to make this incredibly important investment in your future. For more updates, please be sure to subscribe and share.